Good afternoon, all. Welcome to yet another Facebook Live from Milan. I'm Dr. Devi R. I'm an obstetrician, gynecologist, and an infertility specialist from Milan, Indiranagar branch, Bengaluru. And today we have with us our Dr. Vikat Ara Amjad. Dr. Vikat Ara is one among the most loved, sought out, senior most obstetricians and gynecologists in Bangalore. She practices at Al Saha Gynec Center, Fraser Town. And I take this opportunity to extend a warm welcome to Dr. Vikat Ara. Dr. Vikat Ara, welcome to Milan family. So today we are planning to have a discussion on pregnancy which is conceived after fertility treatment. A bird's eye view on how to handle a pregnancy which is conceived after a fertility treatment. So as we all know, infertility is on the rise, and there is one reason or the other why a couple is finding it difficult to bear a child. So if you take help at the right time, get to a diagnosis, find out the cause, and then take the treatment at the right time and stick on to the treatment in the right direction, then success is really inevitable. There is a very high chance that you will get pregnant. Now, what next? How do you handle this pregnancy which is conceived after a fertility treatment? So we do get lots of questions like, is it a normal pregnancy or is it a high risk pregnancy? Is my child going to be normal, or is there any abnormalities which is going to be in this child? What should I eat? What should I not? What exercise can I do? What exercise should I avoid? Can I have intercourse? What are the high risk things where I should get back to the doctor? So these are some of the questions, and more are some of the questions which we are trying to answer in this session. So we are going to give you a bird's eye view on pregnancies conceived after fertility treatment. So before diving into the topic, doctor, I would like to ask you about your own journey. So about your education, your previous practice, the way you set up your center. And so could you please tell our viewers a bit about your journey?
Thank you, Dr. Devi, for your kind introduction. It's a real pleasure to be with you here, to have a nice talk about such a nice topic. I'm Dr. Vikat Ara, practicing in Fraser Town, Al Saha Gynec Center from the past 10 years. Actually, I graduated from Bangalore Medical College in 89-90. After that, I did my post-graduation, that is MD OB-GYN from Bangalore Medical College itself in Vani Vilas Hospital and Bowring Hospital. Soon after that, I had to join my husband in Saudi Arabia. He was working in Makkah, that is the main city of Saudi Arabia. I worked in Hira General Hospital, which is a Ministry of Health hospital, which caters to Arab board and to the MRCOG students. So it was a very nice experience there. Soon after that, we shifted to Yambo, which is another place near the Red Sea. So this also, I was attached to Ministry of Health hospitals there, the government hospital. And I had an opportunity to work in Royal Commission Hospital, which is attached to Aramco. Okay. So that hospital was a very well equipped and highly technical, very good hospital, where I got a lot of good experience in my obs and gynae. After that, then we shifted over to Jeddah. That's nearest because of our workplace job and because of the children's education, because the school's there. Then I practiced there. I was actually attached to an Indian hospital, Jeddah National Hospital, which is run by an Indian there. So after that, I had to think of getting back to Bangalore because of my kids' education, 10th standard, and after that, we couldn't continue there. Yeah. So I came back and planned to start off my clinic in Fraser Town. That's very near my place and where I was born and brought up. So I thought it's a better place where I can get to know, and people can get to know me better. So it has been a nice experience all these years. And in between, I got interested in infertility. It was my passion from the beginning because I loved my patients to go back happy.
Yes.
I thought it was the only thing where it's very fruitful, where OPS gives you something that when patient gets some results and the happiness you see on their faces, and it not only it's the happy couple, it is the entire family
Yes.
and generations. And here I've come to see now practicing in Bangalore from 10 years, the problems which the community faces when they don't have a child, they don't conceive within 1 year, they panic.
Yes.
And they create a lot of problems for the girl.
Yes.
And the girl is always first sorted at, looked at as though she's the culprit.
Yeah.
Now, this is what I'm facing in India, which I didn't see much in Saudi Arabia.
Yes.
It is here, they mainly focus on the moment the girl doesn't become pregnant, the mother-in-law brings her, then the whole family comes, why, what is wrong, but they never complain about the guy.
Yes, absolutely. They forget the fact that 50% of this baby is coming from the man.
Yeah, very true. And this is what I'm facing in this practice in Bangalore.
Absolutely.
So it has to be, a lot of counseling has to be done. They're in such a hurry, they don't want to wait for that period where they can wait for normal pregnancy to occur. They literally get panicky and...
Yes. So I will roughly take our viewers through the main forms of treatments which are available for infertility. Just a brush up on that. So mainly there are 3 types of treatment, as we all know, is available. One is an ovulation induction, where we actually try to grow an egg in a woman, and then we do serial ultrasound scans to monitor the growth of this egg. And then at the right time, we calculate the right time and tell you to have intercourse. That's one form of treatment. This is called ovulation induction for a timed pregnancy or timed intercourse. The second form of a treatment which is there is called intrauterine insemination of semen. So in this also we may give you medicines to grow an egg, monitor by scans, and then on the right day the husband comes and gives the sperm semen to us, which gets processed in the lab. The semen goes through a process called a semen processing, where we remove all the dead sperms, slow sperms, all the waste is removed. Only the best sperms are picked up, and through a fine tube, it is put back into the lady's womb. This doesn't require any anesthesia, no pain is involved. The third kind of treatment is IVF, where we grow multiple eggs in the woman's body at the same time, pick them up through a fine needle. It's an ultrasound guided procedure which is done under anesthesia. So we get the sperm also on the same day, mix each egg with one sperm and make embryos. So after growing these embryos in the lab for a period of 3 to 5 days, we put these embryos back into the woman's womb through a fine tube. That doesn't require any anesthesia. It's a painless procedure. So this is IVF. So now we know about the different types of treatments, and once you have conceived, now what next? The most common questions which we get are, is this pregnancy which is conceived after fertility treatment going to be a high-risk pregnancy? Is there any high risks to me, my health, the mothers ask? Is my baby going to be normal or abnormal? So these are the very common questions we have. Is this a high-risk pregnancy? Are there more chances of complications? Is the baby going to be normal? So how could we address this, Dr. Vikatara?
I think, it's not going to be a high-risk pregnancy. It will be just like a normal pregnancy. No one has to panic about it. And the baby will absolutely be normal. There's no doubt about it. And I feel, unless there are some comorbidities involved, like you have some, patients having diabetes or hypertension, because they come for fertility treatment at a later age, when all this sets in, like hypertension, diabetes, and other co-complications. That we may have to take care of.
Yes.
During our antenatal period, screen out for that. And then once we can tackle those problems, the pregnancy will go smoothly and take a normal course.
Absolutely spot on. So the thing which we would like to convey is that it is your own eggs, your own sperms, and your own embryos. It's just going to be like a normal pregnancy if you had conceived naturally. But many of the patients, because they come at a at an elderly age, or they already have some comorbidities. Because of that, some complications may be seen in the first 3 months and all that. But it's not because of the fertility procedure per se.
Yes.
It is your pregnancy. The same complication, if it had happened, if it had happened naturally, continues. So that is what it is. So many of them ask, why can't we just do a urine pregnancy test, doctor? What is the need to do a blood test to diagnose a pregnancy? Is it required always, or is it okay to just do a urine pregnancy test? Are there any added advantage because we are doing a blood test to diagnose a pregnancy?
Actually, usually after, doing ART procedures and for conceiving, usually we prefer to have a definitive test.
Yes.
Which is a serum pregnancy test.
Yes.
And this not only gives you the qualitative value, but the quantitative value also.
Absolutely.
And then we are going to repeat it after 48 hours.
Yes.
So by that, we come to know whether this pregnancy is healthy, or is it a failing pregnancy, or is it an ectopic pregnancy?
Yes.
Seeing the values. So that's why we advise the couple the lady to undergo a serum pregnancy test.
Yes, absolutely. Now, Dr. Vikatara, could you please just take us through what all blood tests, scans and checkups a lady will have to go through once she is conceived in the first 3 months, next 3 months, next 3 months. So throughout these 9 months, what all blood tests, what all scans and what all checkups will a lady have to go through?
Yeah, the moment, she comes to you with a positive serum pregnancy test, we, as I told you, we'll have to repeat another quantitative serum beta HCG after 48 hours. Then once confirm the pregnancy, we ask her to come for a dating scan, to know the gestational age, and scan at around 5 to 6 weeks just to confirm the site of the pregnancy and the date of the pregnancy. And then later on, once we confirm it, once we see the fetal heart and everything is fine, then we order for the tests. The test could be as like a usual normal pregnancy. We order for routine tests like CBC, RBS, our other blood grouping, then urine analysis, which are very important, and viral markers, and blood urea creatinine, just to rule out any predisposing conditions before. And once that's done, and we tell her to come once the scan is okay, the dating scan, we tell her, we start off folic acid supplements. And if she has nausea, vomiting, we give her some antiemetics. Then we call her for a NT scan at around 12 to 13 weeks. And once that, and then at that time, we do a 75 gram OGCT also, and the thyroid TSH is important. And once we are done with that, in the second semester, we'll call her for a fetal anomaly scan at 20 to 22 weeks, whereby we rule out any anomalies in the baby. And again, at 28 weeks, I prefer, doing again a 75 gram OGCT and a TSH and a hemoglobin.
Yes.
And then the last semester, again, we'll have a growth scan at around 30 weeks, 28 to 30 weeks. And once we see that the baby's the growth is fine and there's no lag in the growth, then she continues her another, that is, I told you, at 28 weeks, I repeat a TSH and hemoglobin and OGCT just to rule out, catch diabetes if it pops up there. And then later on, the third semester, again, the final scan after complete of 37 weeks with a biophysical profile and everything.
Yes.
And again, repeat a hemoglobin at 37 weeks with TSH and OGCT.
Yeah. So I would like to just add my bit here. So if it is a pregnancy which is conceived after a fertility treatment, in addition to this is what is routinely given to any pregnant lady. What Dr. Vikatara told is what is given to a lady in a routine pregnancy. Now, in addition to this, in a fertility medicine, if you have conceived with a fertility treatment, we may ask you to take some pills called progesterones. Yeah. So this is an additional pregnancy support which we may have to give to the woman in the first 3 months of pregnancy. So when the woman has conceived naturally, there is no need to take this medicine most of the times. But when we have used medicines to bring forth an egg in you, then yes, most of these pregnancies require this additional pregnancy support in the form of progesterone tablets. So this is something which you will be taking in addition to your usual tablets, and this usually we stop it at first 3 months. And then also in IVF, and so this is for normal cycles like intrauterine insemination or ovulation induction. But if it is IVF, yes, for the first 3 months of pregnancy conceived after IVF, the lady will be under more of a pregnancy support tablets in the form of vaginal tablets, sometimes gels, sometimes a few injections and tablets to eat also. So yes, you can expect this also in a pregnancy which is conceived after a fertility treatment. Now let's move on to the one of the most widely asked questions, the diet. So many people ask us, what should we eat when we are trying to get pregnant? So I would say just be on a healthy diet. There is not much that you should avoid in your period when you're trying for a pregnancy. Be on a healthy diet, less of carbohydrates, more of complex carbohydrates like fruits and vegetables, and lots of handful size of protein, a serving of dry fruits every day, lots of water, cut down your sugar. These are the general advices which we give when they're trying to get pregnant.
Yeah.
Now in pregnancy, what is the diet which they should follow?
It is more or less the same. I mean, once take after a fertility treatment, same way, like in a good high protein, complex proteins and carbohydrates, maybe carbohydrates around 50 to 60% and proteins around 30% and 10% fat, and take vitamins and minerals in form of fruits, vegetables. They can take it in the form of 3 meals a day with 3 snacks.
Yes.
That is, easy way to follow the diet after conceiving.
Should they really be avoiding something? Everybody asks, can I eat papaya, doctor?
Yeah.
Can I eat pineapple, doctor? So what do you think, doctor?
I think raw papaya.
Yes.
Is better. They avoid raw papaya and pineapple because they say that papain enzyme causes problems. So otherwise, nothing else. The pregnancy they can eat normally and nicely.
Yes.
And drink a lot of water.
Yes.
This is what they never do.
Yes.
So at least 2.3 liters, 2 to 3 liters of water per day is a must to avoid constipation and urinary tract infection. So I suggest that with a good healthy diet, a balanced diet, and with this water intake, pregnancy should go off fine, inshallah.
Yes. And coming to the exercise. So what are the exercises if they ask us during when they try to get pregnant? I would tell my patients to continue the activity which you are doing. The exercise, when it comes to exercise, continue the activity which you are doing when you are trying to get pregnant, especially in the period after ovulation. I would tell them not to start any new activity now. But if you're already doing something, just continue with that. If you're already lifting weights, don't increase your weights. If you're already walking, don't start running in that period.
Yeah.
Or if you are already not going to gym at all, don't start your gymming in that period, but continue your walking. That's what I would say when it comes to the period when they are trying to get pregnant. But once they are pregnant, what exercises can they do?
It's the same, more or less the same. I told you the pregnancy as such takes a normal course.
Yes.
Even after fertility treatment. Here it's the same thing. Don't add new exercises.
Yes.
Whatever they have been doing, let them do.
Yeah.
But in the initial period, I would tell them not to do some heavy weightlifting or complex high impact exercises.
Yes.
Yoga and some light gardening and daily chores, all that can be done.
Yeah.
It's not that they have to take complete bed rest or anything like that. They can, they should not add extra, as you told. They should not start off a new exercise during this period.
Yes. So the question of which exercise should be avoided that's it.
High lifting heavy weights.
Yes.
And high impact exercises, which strains you and you'll end up with some premature uterine contractions.
Yes.
That should be avoided.
Dr. Vikatara, is there any exercise which will increase the chances of them going into normal delivery?
I think exercises which, the lower lower abdominal muscles, and which helps in squats. Squats help a lot for a normal delivery. And I suggest walking. Walking is good enough. In the last semester, I'm walking vigorously and nicely. Once they complete the term baby, walking really helps a lot.
Yes. Walking even helps the head come down, the pelvis to open up, and you do lots of squats and sit-ups. The pelvis, the leg muscles get strengthened. The pelvis opens up, and there is, yes, obviously more chance you will have a normal delivery. So exercise anytime in pregnancy is good unless you have high risk factors, which we will come to later. Now, another very commonly asked questions which we get is, can we have intercourse? So when they are trying for a pregnancy, obviously, what I tell our patients is, when you are trying, even if I am planning an IUI for you, please don't abstain in the period before during which we are trying for an IUI. Long abstinence is never good. It will damage the sperm's quality. So whenever you want to have intercourse, you just have intercourse. Is the rule during your treatment in simple cycles. Even after an IUI and all, you can have intercourse. There is absolutely no restriction to intercourse before and after an IUI or an ovulation induction cycle. But when it comes to IVF, it is different. Now in IVF, when we grow multiple eggs in you, the ovary size becomes more. So if you have intercourse at that time, there is chance of complications of the ovary twisting on itself and the blood supply getting affected and pain happening, hemorrhage happening, all that. So due to these risk factors, we will tell you to abstain during an IVF, but not for other cycles at all. But now what in pregnancy, once they have conceived, can they have intercourse?
Yeah, once they have conceived and they're not having any, they're not complaining of any bleeding or spotting or any irritable uterus or anything like that, I think it should run a normal course. Yes. There's no need to abstain at all.
Yes, absolutely. Dr. Vikatara, are there any specific do's and don'ts which you would want to tell our viewers about in pregnancy? Do's and don'ts, which you usually tell your patients.
Actually, these patients who conceive after fertility treatment are very anxious, and more than us, they come out with even a small complaint. I get a lot of telephones. For every small complaint, they want to ask me before they do something. They are very worried. They think this pregnancy is very precious, and at any cost, they should not lose the pregnancy.
Yes.
So I tell them, this is what, be normal, eat normally, nicely, have a balanced diet, go for walking, take naps between, don't strain yourself, and keep yourself busy with your hobbies, with your work. Don't concentrate much. Don't take pregnancy as something...
as a disease.
Yeah. Yes. You take it as a natural course, it will run normally.
Yes.
And I then tell them not to do heavy weight lifting or going on, especially they like to travel. Nowadays, doctor, can I travel? So, now the season is like that, and the roads and the traffic, and I tell them, you take care, ma, about...
Everybody said probably after lockdown that they would want to travel also, yes. So I would also say there are no particular restrictions per se. You just go a little carefully. Don't strain yourself. What I always
and high impact exercises and heavy weight lifting. Don't do it just...
only
just take care, and they really take care. And I'm very particular. I tell them about, especially tell them that any symptoms like any leaking or any pain abdomen or spotting or bleeding, anything like that, you please report.
Yeah, so these are the danger signs.
And decreased fetal movements in the later stages of pregnancy, because some of them, they neglect this.
Yes,
so they don't keep account of the fetal movements, and they don't realize it's so important. So,
I was just going to ask you that only. What are the danger signs with which they should report back to you? So exactly these. The leaking, any spotting, any reduced fetal movements, or any unusual symptoms, you should report back immediately to your doctor. Now, shall we discuss a little on what is a cervical stitch, because many people ask, to us at least, do I need a cervical stitch in pregnancy? So what is it? Why should it be put? For which people do we usually put the cervical stitch?
Okay, cervical stitch are some procedures which you use some synthetic material to reinforce the cervix in pregnancy. In pregnancies which have, a short cervix.
Yes.
It's not for all the ladies.
Yes.
Mostly when we keep scanning the patient from the early pregnancy, and when we see a short cervix mostly after the NT scan, less than 2.5 cm, I advocate them and advise them to undergo a cervical stitch. It's a simple procedure.
Yes.
Just they get admitted for a day,
yes,
and they can be discharged the next day.
Yes.
It is just to reinforce the cervix so that they don't land up with preterm labor.
Yes. Even in some scenarios where if you have gone through a kind of a hysteroscopy where we have actually dilated your mouth of the uterus beyond a particular point, we might ask you to put it prophylactically in advance. Only in some cases, even in most of the cases, as Dr. Vikatara mentioned, we will actually be monitoring your length of the mouth of your uterus or cervix through serial scan. Then we take that decision. Sometimes, yes, we do put it prior itself if we have already done a procedure like this for this particular lady. So with that, I think I have covered most of the questions which we were planning to discuss about the topic. So if there are any questions, we will take them, and if you have any further questions also, you can just type in the comments box. We will keep answering to you. So I will take any questions if there are any. So we don't have any live questions right now. So if you have any questions regarding this topic or any other topic, please put it in the comments box below. Our team will collect it and give it to us, and we will make sure that we will reply to your questions. So thank you so much for listening to us in this lovely afternoon. Thank you so much, Dr. Vikatara, for coming over to this live and sharing your wonderful experience with us. So we are so happy to have you here, and so thankful to the viewers also for listening and participating. So thanks everyone. Thank you so much.
Thank you, Dr. Devi. It was a lovely having a nice talk.
Yes.
On this nice topic.
Yes. Thanks everyone. Thank you.